Health Lecture Series by UCSF. And it's my pleasure today to introduce Dr. Paul Krezanoski. He's an associate professor of medicine and pediatrics at UCSF. He attended Boston University School of Medicine and completed residency in a combined internal medicine and pediatrics program at Massachusetts General Hospital. He now has over 20 years of experience working on global health research projects in Madagascar and Uganda and Eswatini. And he has expertise in malaria prevention and is the inventor of a novel tool for studying the use of anti-malarial bed nets. He was actually one of the mentors for one of our prior pathway residents who is going into Penn. And he's also the founding director of Opportunity Solutions International, a nonprofit focused on using rigorous research approaches to evaluate innovative solutions for improving global health. We're really happy to have you here today. Thanks, Paul.
Thank you very much, Teresa. Thanks for that great introduction. So I will ask, I am dialing in from Uganda today. So if the connection goes bad or wonky, please let me know. And I may actually just take my video off at some point, but I think we'll be okay. Give me exactly 1 second, and I'm pulling up my slides just now. Here they come. Great. So let me share my screen and we'll be off. All right. And another thumbs up if you can see my screen. Hopefully.
Yeah, we see the full view.
How's that one?
Presenter view. I have the same problem.
Okay. Let me see. I'm not sure what I do.
I think in your
Can you guys see the slideshow?
That's perfect.
Okay. All right. All right. All my technology experience is coming in handy. All right. Wonderful. All right. Thanks, everyone. So very nice to meet you. Thank you, Teresa. My name is Paul Krezanoski. Yes, I do both adult and child medicine. I currently live in Uganda and I do research on malaria. And I'm going to talk to you today about Bednet use and some approaches I've come up with for measuring Bednet use in ways to help improve child health. So a couple of disclosures. First, as mentioned, I do have an affiliation with a nonprofit organization that I started some 20 years ago now. I don't get any salary from it, but I do need to tell you that they've funded some of my research over the years. Also, I did invent a device called SmartNet, which we'll talk about during this presentation. Also has not made me any money, but I do need to let you know that that's something I do have some intellectual property in. So here's an outline of what we'll talk about today. First, I'm hoping that we can, we'll talk about the current state of malaria and prevention of malaria with bed nets in particular. Then I'll talk a little about the kind of the conceptual framework of how I think about bed net use. We'll talk a little about some studies I've done in the past looking at ways to improve and understand ownership of bed nets, use of bed nets, and then get into some of the tools and newer tools that I've been using to try to better understand bed nets. So first, in 2021, there were almost 250 million malaria cases throughout the world, almost 620,000 malaria deaths. Up until about 2015, we were making pretty significant progress in reducing this malaria transmission. But since 2015, particularly in sub-Saharan Africa, malaria has essentially stalled. We have not made much progress at all. And in fact, in some countries in sub-Saharan Africa, Uganda is one of them, malaria is actually worsening. And at this point, 95% of all malaria cases and deaths occur in sub-Saharan Africa. In particular, in African children. So African children bear the burden of malaria. 76% of deaths from malaria occur in children under 5 years of age. And really, this has not changed significantly over the last 6 years, 7 years now. So we're really talking about a problem of African children. Malaria has become essentially a problem in Africa among young children. So what tools do we have? And in particular, what's our main prevention tool is the long-lasting insecticide-treated bed net. So if you've ever traveled abroad, you may have used some of these, but essentially they're nets that are meant to be put around your bed at night. They have some insecticide within them so that when mosquitoes land on them, it kills the mosquitoes and also provides a barrier protection. These had been, up until about 2015, associated with pretty significant decreases in child mortality. They were very effective in randomized trials in the 1990s. Almost 20% reduction in child mortality. And it was estimated that almost 70% of that reduction I showed you in malaria incidence was as a result of widespread distribution of bed nets. 200 million bed nets were distributed just last year, and at this point, billions have been distributed over the last 10 years. However, the WHO has essentially recommended for all 3.2 billion people worldwide at risk of malaria, everybody should have access to a bed net. And typically that comes down to 1 bed net per 2 people as a recommendation. So even though 200 million bed nets were distributed, that's still not enough to meet that threshold. So I mentioned this quickly, how bed nets work. This is a bed net that's folded up, kind of stored away from the bed area. They provide both an individual protection, but also a community-wide protection in that they kill the mosquitoes. And actually, if you have an effective insecticide, you can actually reduce the overall population of vectors that can spread malaria in your community. So my work really looks at trying to understand bed net use behaviors and how they interact with vector behaviors, the mosquitoes that are spreading malaria. And the goal is hopefully to design more effective interventions to protect children from malaria. So I think of this in trying to answer 2 kind of important questions. First, how do we get the bed nets into the house? How do we, this is, around providing access. How do we make sure that every house has access to enough bed nets to cover the people that live there? And then secondly, what factors affect whether people use the bed nets, and what factors affect how they use those bed nets? So we're going to address these questions in some of the next few slides. Some potential barriers, maybe possibly people don't understand what causes malaria, and that's a potential barrier. So then we can think of doing things like education campaigns, which are in reality these days are ongoing all the time, is education about how malaria is transmitted. Another potential barrier could be availability. Maybe people don't know where to get bed nets. So then we can think about kind of logistical systems wide changes to make sure everybody gets a bed net delivered to their door, or gets a bed net after at an immunization visit. These are some approaches that have been tried. Or maybe there's cost.Maybe people can't afford bed nets. So maybe we should think about making sure that they're free for people to use. So back in early 2000s, when I was a Peace Corps volunteer and then subsequently in medical school, I did some work in Madagascar. And one of the first questions that came up was whether bed nets should be given for free, or a price should be charged for them. And this was, at that time, a pretty interesting question, because it was thought that if you charged a price for the bed nets, people might value the bed nets more and might be more likely to use them. So that was what motivated this study. We randomized 350 households to varying prices of the bed nets. And then we looked in the next few months and looked at how likely people were to go and get a bed net and how likely they were to report using their bed nets. So at baseline, this is an important thing to point out, is that only 4% of households in this area own bed nets. So nowadays, again, this was back in 2004, 2005. Nowadays, there's the access to bed nets in this area is actually much higher. Unsurprisingly, if we gave a bed net, if we gave you a coupon to get a bed net for free, 100% of households went and got it, because they're like, hey, I just have to go to the market and I get a free bed net. So bed nets were in high demand. And interestingly, you can see that the ownership of bed nets, people's likelihood to get a bed net decreased as the price increased. So this is some people lined up to get their bed net with their coupon. So this figure, I think, shows that a little bit clearer. So the top line, the blue line here, is ownership. Down at the bottom, we're looking at different prices of bed nets. And just for reference, free is obviously free. These are Ari, which was the Malagasy currency. market price at that point was about $5, I would say, in American money, US dollars. And so as you can see, unsurprisingly, elasticity of demand, as the price goes up, fewer people are willing to obtain a Bednet. Interestingly, however, you do see this gap with use. So, once someone had paid 1,000 Ariari for a Bednet, they were pretty likely to use it. However, people that got their Bednets for free didn't use the Bednets as much as people who had paid a small fee for them. So this provided some, we published this some years ago, but it provides some evidence that perhaps charging a small amount of money, clearly it's not clear exactly how much, but charging a small amount of money might help induce people to use their free Bednets. Nowadays, mostly populations are essentially just blanketed with Bednets in universal distribution campaigns, usually shooting for one Bednet per 2 people in the ideal world. That doesn't always happen in reality, but these days, most Bednets are distributed for free. So the next question we had is, okay, so is there a way that we can, we see this use curve decreasing? Is there a way we can help incentivize people to use the Bednets if they have them? And so we developed another randomized trial to look at how we could use household level incentives to help increase the use of Bednets. So this was within the literature of behavioral incentives, which is still pretty popular these days. Looking in the developed countries, it was looking at things like weight loss, tobacco cessation. It's been used in developing countries at that time. Look at incentivizing immunizations or maternal care. But no one at that point had looked at using behavioral incentives to encourage the use of insecticide-treated Bednets. So this was this I actually ran during medical school, was a study, another randomized trial looking at of 520 houses. And essentially every house got a free Bednet with 1 coupon. Again, this is a similar area in central highlands of Madagascar. But the intervention households were told that a month later, we would do an unannounced visit to the house to see if the Bednet was being used. And if it was being used, they would get a bonus. And it was an unspecified bonus. We ended up giving some household goods like some rice and beans and sugar, which was probably worth $3 to $4. But that's what we ended up using for our bonus. But they didn't know that at the time. They just knew that we're going to come at some point and provide a small bonus. So the results of this study were interesting. Baseline is near the origin here. You see that essentially 6% of households were reporting Bednet use every night, 5.6 versus 6.1, no significant difference. Within 1 month, the intervention households, when we did these surprise visits, 99% had a Bednet hanging over a bed. That's how we visually observed that a Bednet was hanging over a bed, and that was our definition of use. And only 78% of households in the control group were using their Bednets. Interestingly, we went back at 6 months. You do see some regression there. The top line there is 93% use in the intervention group and almost 90% use in the control group, and no statistical difference at that point. So, and this has actually been found in other studies of incentives, that it does seem to be that there is an immediate impact of the incentives. When the incentive is active, you can push behaviors a little bit, nudge behaviors, but then over time, those incentives tend to revert to the mean, and maybe people are just acting like they normally would without the incentives in the long run. Interestingly, though, if you think about this kind of differential use, in the sense that the incentives provided additional use than we might not otherwise have had, that could be cost effective in some situations. For example, with pregnant women or with young children, where Bednet use is per night of use is quite valuable. So there are some ways that these incentives might be useful in the future. Just an area for future research. So I'm going to stop here. So those are some early studies that looked at kind of ownership of Bednets, and trying to understand how people interact with these, both in terms of getting into the house and some things that look at use of bed nets. And then we're going to transition to looking at other ways of understanding how bed nets are used. I'll stop here and just see if there's any questions, just looking at the chat. And if not, I will keep going. All right. Feel free to interrupt me if anything else comes up. So as I mentioned in my last study, in the randomized trials, we did some visual observations of bed nets to see if they were actually hanging over a bed. And that's what we assumed to be a measure of use. So in bed net research, there's a lot of money and resources invested in these bed nets. We don't really have a good measure of how they're used. And the reason is because our tools for measuring bed net use have some limitations. So the most common way that are used in malaria control programs is to ask people if they used their bed net the night before. As you can imagine, there could be some biases in that, especially if you're going around giving out free nets and then you go, some months later and be like, hey, did you use that net I gave you? You can imagine that there may be some social desirability bias, they call it, where people will say, sure, of course I use the net. In addition, those self-reports don't really give us a good sense of differences in use, except at the time when we asked. So you don't really get a good sense of variations in use. Other tools that have been used besides asking people is visual observations, sort of like we did in our other study. Some studies have actually done unannounced night visits. So like looking, going in at 9 p.m. at night and seeing who's under what bed net, obviously in research settings that people have agreed to be part of. But as you can imagine, some of the logistical challenges that come with observing people during the nighttime in their bed spaces. You can imagine some of the logistical challenges that exist in trying to understand how bed nets are used. I mentioned this a little bit, but essentially, cross-sectional surveys where we ask on one night can really only give you information about use that night before during that season. And there actually is a lot of evidence that bed net use is very heterogeneous, changing very frequently, and there's a lot of very complicated behaviors that occur at night. You can imagine people getting up to go to the bathroom, getting up to, soothe a child that's crying, a lot of entries and exits from bed nets. And all of those have implications for people's risk from malaria. So understanding how bed nets are used requires a better tool. In addition, I mentioned this quickly, but the kind of social desirability bias and recall bias, I did a meta-analysis that looked at studies that had measured self-reports in the population and at the same time had used a more objective tool to measure whether the bed nets were being used. And essentially, you can tell the forest plot here is kind of moving to the right, which says that essentially self-reports overestimated bed net use by about 13%. And not surprising, but it was helpful to quantify that. And in fact, in some of the studies I've done in Uganda, which I'll talk about later, around 14, 15% is actually exactly what we found in overestimation of self-reports. So the social desirability bias is a real thing, and just points to the value of more objective tools for measuring bed net use. So I've set out on this odyssey working with many different partners and engineers and people that have helped along the way since 2012, trying to work on developing a tool for monitoring bed net use. So the main goal is to objectively measure when a bed net is either unfurled for use, what I say is like, put down, you kind of see that in the top right picture, or when the bed net is folded up. And you see kind of two ways typically that a rectangular bed net could be put up. Sometimes they'll fold it in a knot, sometimes they'll just throw it up over itself. The reason that many households will do this is because they only have limited space in the house, and often the bed area is actually used for eating meals or children playing. Bed nets that are left hung down are at risk of getting damaged, and so people typically, in my experience, will actually keep their bed nets folded up during the day. In addition, it would be ideal to have a tool that can measure timing and interruptions in use if we're trying to figure out more precisely how bed nets protect from malaria exposure, that's a useful tool. So these are some of the metrics that we can actually get by using a more longitudinal and objective measure. One is just missed nights of use, and this is kind of a rough measure, but if people, a rate of how often in a week, for example, someone forgets to put their bed net down or just doesn't use their bed net. Another one would be kind of seasonal use patterns. So changes, as I mentioned, changes over time during the year. And malaria traditionally comes with the rains, for example, in Uganda. And so understanding how bed nets are used in the dry season compared to the rainy season could be useful. Another metric you can use is just how many hours of coverage people are getting on average. You can also look at timing of use. For example, what time a bed net is being put down, what time a bed net is being folded up. It turns out that when you match up bed net use with vector exposure, that can actually be very important in terms of quantifying the total risk of malaria. And then I talked a little bit about interruptions in use during the night, how frequently people are getting in and out of the bed net, and then how long those interruptions are. There's a way to measure those that would give us more insight into how people are into malaria risk. I'm going to stop for a question here. There's a good question from Barbara talking about people sleeping in not traditional beds and actually on mats or in other ways. That's a very good question. That happens in Uganda as well, maybe less often than in some other places, like in West Africa in particular. I know there's a lot of outdoor sleeping as well, or there's like temporary sleeping areas where people will have mats that they lay out and then pull up during the day. The tool I'm going to describe, it can measure some of those things, but that's another very important risk factor is what we call sleeping arrangements and how people sleep. It's another important risk factor for malaria. It's also very it's been associated with different ages as well, which is a big similar risk factor for malaria. So we'll talk a little about that as well. Okay, so next we'll just talk about one of the ways that I came up with trying to measure bed net use. So this is the tool that I described at the beginning. This is called the SmartNet. So the SmartNet is it's gone through multiple iterations. So this is kind of, I would say, the last version, and I have an even newer version, which we'll talk about a little bit later in the presentation as well. But essentially, the idea we came up with was to use conductive fabric. So you see these little patterns that are sewn into the bed net. It's actually conductive fabric that when the bed net is folded up on itself, actually detects the completion of a circuit. And then you can log that measurement time, and you know whether the bed net is being used or not being used. So these are some of the details. It can last about 8 weeks. We would integrate them into WHO approved bed nets. And it was quite accurate. Sorry, it's important to say it was about 98% accurate in measuring how the bed net is being used. These are just some other pictures. We actually had a seamstress in Uganda that actually made these for us. And this is the president of Uganda. He also likes our nets. So, so when you're coming up with a new tool, some of the most important things to think about first are acceptability and feasibility. So we did some studies back in 2016 showing these bed nets to women and family members, asking them what they thought about them. Some initial people that looked at it gave us some opinions about the electronic components and talked about the objective monitoring. And so we tried to take those lessons into our future research. We also did a more in-depth qualitative study that we published a couple of years ago, where we actually did in-depth interviews with actual users of the bed nets, and again, similar questions and similar issues with the idea of the electronics. However, in general, positive comments about being okay with having their bed net use measured with the caveat that it has to be well explained to people exactly what's being measured and what's not. Again, highlighting kind of the private area in which this kind of monitoring is going on. After we did these kind of acceptability studies, we did a feasibility study and early pilot study where we gave one SmartNet per household in 10 houses in Barara, which is in southwestern Uganda. We measured Bednet use for 6 weeks per house. You can see here, each of these little plots is a household, 1, 2, 3, 4, all the way down to 10. And each of these black bars, which you're seeing, is essentially use from 1800, which is 6 p.m. at night, to 9 a.m. the next morning. And you can see some very interesting patterns in Bednet use, which we're describing more and more. Some houses will leave them down almost all the time. Some houses will use them regularly. Some houses have big gaps in between. It's actually quite interesting. Bednet use is very heterogeneous. But seeing it visually like that is helpful to kind of see a range of different uses of Bednets just in a sample of 10 houses. It also allowed us to look at some of those metrics that I talked about. So this is, overall proportion of hours by time of night that you get coverage. And again, you see a lot of variation here. Household number 1, didn't even if by 2 a.m. was only using about 63% of total hours of coverage, whereas household 5 was using 100% of the time from midnight till 6 a.m. So again, just highlighting the variation in use. And this plot is actually showing some of those described as interruptions in use. So each bubble here represents an interruption, and the size of the bubble represents how long that interruption lasted, and then it's just stacked by house. And you can see early in the night, there's a lot of interruptions. We define interruptions as once the Bednet goes down, any other time the Bednet goes back up, that's an interruption. So you can see that early in the night, unsurprisingly, there's a lot of things going on. And again, around 3 and 4, other things are happening, the interruptions in coverage. But this is the sort of data that this longitudinal device can provide. So the question then is, okay, so we've described some of these patterns, and I've written publications where we describe some of the patterns of use, but how can we use these tools to actually understand how malaria exposure is sneaking in, how malaria exposure is still occurring despite the use of Bednets or despite access to Bednets? So we did a study now in Eastern Uganda, in Tororo, working with some collaborators, UCSF, Grant Dorsey, and a group that he runs in Tororo, to deploy Bednets in 20 houses in 2019. In this study, we actually covered every sleeping area with a SmartNet. And then at the same time, we did some measures of mosquito exposure, both doing overnight mosquito catches and also something called human landing catches, which can give you information about the timing that mosquitoes are biting or landing on people to bite. And the goal was to look at the gaps between when people are using their bed nets and when they might be exposed to mosquitoes. So some of the findings from here are useful, not necessarily novel. School-age children and young adults are actually not very good users of their bed nets. This has been something that's been described elsewhere with sort of self-reports as well. But essentially, we found that children that were age 5 to 15, what they call school-age children, were about two times as likely to miss a night. Their rate of non-use was about 2 times that of children that were under 5. And young adults also 15 to 30 also were like 2.6 times the risk of not using their bed nets. Interestingly, the under 5s and older adults tended to use their bed nets very similarly. There's no real difference there. And so based on, then what we did is trying to combine those two things, the measured bed net use, combining the times that people reported being under their bed, under their bed net in bed in their sleep time, and then also the timing of biting that we were able to estimate from those mosquito kit collections. we estimated that the bed nets only protected against about 50% of potential exposures. And that's not a very high number, to be honest. We're spending a lot of money on bed nets. There's a big push now for newer types of bed nets that are using new insecticides, and only covering about 50% of potential exposures suggests that there's going to still be a lot of malaria transmission occurring. Interestingly, you can see a stepwise decline and this is mostly because of behaviors. You can see that children under 5 got about 61% protection, whereas adults over 30 only about 48% of protection. That comes from a combination of their bed net use and also what time they go to bed at night and whether they're indoors or outdoors as well. So clearly bed nets are not protecting against all exposure. We can say that for sure. This finding is, I would say, on par with some other studies in Eastern Africa that have tried to look at this. They've mostly used self-reports, but they found that bed nets, there is a fair amount of exposure that's still occurring despite bed net use. And that's really pushing people to look at other approaches to prevent malaria, or at least to prevent malaria during the times and the places where it's still occurring despite use of bed nets. So it's another natural stopping point. I can stop there to see if there's any questions. You can type in the chat, or if you wanted to just speak up. But next we'll talk about some newer ways, newer developments that we've come up with for improving these monitors. But I can stop for a second.
There was one comment in the chat, Barbara. I don't know if you wanted to ask it, if you wanted me to read it. You addressed that?
I addressed it quickly. Okay. Barbara, did you want to, was that helpful?
Yes, thank you. You said you were going to talk about it more and later, so I will.
Yes. Let me talk about it more now. So, in our research, so, we use these devices. We use these devices mostly in controlled cohorts and in studies where we track exactly where people are sleeping. We track, what sleeping areas they're on. There may be some challenges in using a device like this. If sleeping arrangements are very fluid, and if people are sleeping outside, again, that's a challenging place to measure their bed net use. In Uganda, as I was mentioning, there's not as much of a culture of outside sleeping as I've read in other studies, in particular in Western Africa, in my experience. But I'd be interested in you mentioned in your experience. I'd be interested in what you've seen.
Yeah, well, I've worked in Western Africa and in Haiti, and there's a lot of outside sleeping and lots of sleeping on the floor on a little mat or a towel or something like that. So we've had a lot of problems getting people to use mosquito nets because they have no way to set them up. And so that I was just curious if you gave stands or hooks for walls or anything like that along with your nets.
So that's a very good point. So and that's actually something that's been seen in the literature, is that it gets very hot, and being under a bed net, some people complain that it's very stifling, and so that's one thing that's one barrier, is that people don't want to. It's very hot under the bed nets. It's another barrier. Also, being able to put the bed nets up. There was a study. There have been some studies that have actually either gone out to houses and seen what the evaluated. Helping people called put up campaigns, giving people nails and hammers, and actually putting the bed nets up for people. And there have been some studies of that as well. In our cohorts, we don't. Our cohorts, if they needed that help, would get it. Essentially, we cover everybody with bed nets, give them replacements at any time. So it's sort of an idealized situation, but that's a big problem for bed nets in general. And it's something, again, that's pushing the malaria control community to think about other approaches to prevent malaria. But a very good point. All right, we'll move on to the last portion here. So, so we talked about what motivated some of the what motivated this idea of trying to come up with a better tool for measuring bed net use. I described the SmartNet tool that I used for some years. And there were some challenges with that one. So first, this fabric pattern on a bed net that could change how people act. Some of our acceptability studies suggested that people didn't like this idea of having these electronic components, these big bulky electronic components in particular, up near their bed nets. The making the bed nets is actually the smart nets in particular. It's complex, and you have to have someone like sewing conductive fabric. Conductive fabric is not cheap. Some of the battery life, it didn't last as long as we'd like. You can't really wash it well, and there were some issues with people tampering with electronic components, like taking memory cards, and mostly children just acting out, that kind of thing. So there were some challenges with the SmartNet technology that pushed us to think of some better ways to measure bed use. So this is sort of our latest tool. This is using accelerometers. So these gene active accelerometer watches that you see there are tools that are used. It's another one called Actigraph, which is often used in the US for basic activity monitoring. They'll use it a lot in obesity research and childhood activity people may be familiar with. So they're basically watches that people will wear, and they could track steps essentially. We also found that by using these accelerometers, by attaching them to a bed net, we take the bands off, and essentially you have a small watch face size, 30-gram little device that you can attach to the bed net. And when that bed net is being used, you can look at the accelerometer data and actually classify how the bed net is being used. And so this approach was really pioneered by some colleagues of mine at Liverpool. And then I was brought in to help them with some analysis of the data. And this is actually the tool that we use at this point. It could last longer. It's much less obtrusive, less obvious to people. And we've had good success with this so far. This is that original study where they started using the accelerometers. And then this is the more recent study from a couple years ago where I helped out with some of the analysis, and we actually developed a machine learning algorithm that was able to take the accelerometer data and was able to, in a very simplified model that just looks at whether the bed net is up or down, is about 96% accurate. And then you could also include detection of when people are, entering and exiting a net once it's already folded down. So that's getting at some of those intra-night behaviors I was talking about. That was about 83% accurate. So this is a pretty promising approach that, as I mentioned, we're using in some other studies now to measure bed net use. So I'll kind of finish up with a couple of lessons and some future areas of research, then we can answer any more questions you might have. So, as I mentioned, there are a lot of ways that we can improve our bed net education and malaria prevention. One thing that we found in particular is that when people don't think they're being exposed, there's a tendency to not use bed nets as frequently. And that sometimes is not it's not as safe. I mean, essentially, the mosquitoes that are the most nuisance mosquitoes are typically what are called Culex mosquitoes. Those ones actually don't spread malaria, and it's actually the Anopheles mosquito, which is less easy to detect. They're smaller and they're a little bit more sneaky. So essentially, bed net use is the people's best bet to prevent malaria, and they, especially in Uganda, they need to be using their bed nets essentially all the time, which, as you can have seen, is a challenge. Age is a really significant factor, and so this is where kind of pediatrics and adult medicine as well comes in handy. Age is a really significant factor in bed net use. There's some really interesting implications of how children share bed nets with their parents. So one of this study in Uganda that I was mentioning, we found that children would tend to go to bed around 8 or 8:30. These are younger children. And then their parents would go to bed about 9:30 or 10. That's pretty similar to in my household. But what was interesting is that the bed nets for those children would not go down until the parents went to bed. So that's an example of some information that we got from these devices that then could be actionable in the sense that we could do an education campaign to get people to put their bed nets down when the kids get into bed. And that could be an hour to an hour and a half more of coverage per night that these kids are getting. So it's just some examples of how sleeping arrangements within households can provide some insights into new interventions. And then school-age children are a challenge. They typically don't use their bed nets very well at all. And in reality, they also are a very big reservoir. Part of the challenge is that school-age children don't typically get malaria as frequently as their younger siblings. And that's because they've developed immunity over time. It's similar for adults. But the challenge is that school-age children are a very significant reservoir in a lot of places, that they have parasites in their bloodstream, but they're not actually getting episodes, and they're not getting febrile, they're not getting very sick. So then they actually can provide a reservoir for the rest of the community for mosquitoes to bite them and then continue transmission in the rest of the community. If they were using bed nets, that would be less likely to happen. So school-age children and bed nets are a very big target for bed net use, and we were able to show that they don't use their bed nets as well as they could. And then we talked about that bed nets seem to protect only about 50% of potential exposures. This is in a high transmission setting, and we talked a little bit about, do we need other tools? So there are other tools that focus on outdoor biting, for example. There's, there are other vector control tools like spraying that we can do inside houses. There's toxic sugar baits and spatial repellents. There's some people at UCSF in particular looking at spatial repellents and seeing if those are things we can use to keep more mosquitoes out of the house. So I think this tool may help us, and actually I'm working on an R1 application right now where I'm arguing that using these tools could help us figure out, where are the areas that we can intervene on, and do we need to put more emphasis on other tools outside of bed nets. So some next steps that our group's looking at. First, why do some individuals tend to use their bed nets so frequently and other ones don't at all? So as I showed you that slide of a lot of heterogeneity, this is well described. I'm doing a project now where I'm trying to look at where this variation is coming from. Is it within individual behaviors? Is it within houses? Is it within geographic settings? What are the origins of this kind of heterogeneity in bed net use, with the idea that maybe that can help improve how we target our education. Qualitative interviews are always valuable to try to understand what people are thinking about. And so we actually just finished a study where we interviewed children down to age 8 and adults as well. And that's we're actually doing the analysis right now of those transcripts, but we're trying to look at children in particular who are, the school-age children, as I mentioned, are problematic in their bed net use, but they've really never been asked in a research setting why they don't use their bed nets or what barriers they have. So we're hoping that can add a little bit to the literature as well. I talked a little bit about some improving the accelerometer methods. I'm working with some people at PATH to develop our own device. Those accelerometers that I showed you are quite expensive and not obviously designed for measuring bed net use. So we're working on trying to make a proposal to Gates to actually develop a specifically designed tool that's an accelerometer that could be much cheaper and could make this sort of monitoring easier to use for people. In addition, we're doing field studies in some other settings. I've been using them in Uganda. I'm involved in a project in Cote d'Ivoire that's underway. And then hopefully in the next month or so, we're going to be rolling them out in Cameroon as well. These are all places that rely on bed nets to prevent malaria, so they're very interested in this sort of data. So in conclusion, I hope you've taken from this talk that malaria remains a really big problem, a really significant cause of child mortality, now settled mostly on Africa. Bed nets have been one of the most effective tools that we've had. And there, 200 million of them were distributed last year. They're a very widely distributed tool for Bednet for malaria prevention, although there's concerns that they may not be as effective as they used to be. There's a lot we don't know about how malaria transmission and mosquito exposure interacts with how people use their bed nets. Human behaviors and vector behaviors is an active area of research for me. And I think it will point the way in the future to some ways to improve malaria prevention interventions. So that's kind of my mission statement again. So thank you. I think we're about 45 minutes. So I hope that was useful to you all. Many people have helped along the way. These are some of the collaborators that I've worked with. And I want to thank you guys for your attention, and I'm happy to answer any questions you have.
Paul, really appreciate you logging in, especially from Uganda.
Luckily, it's not too late here. It's only 6:30 or so I'm okay.
Oh, good. Yeah, I remember. I think last year it was like your 3 a.m. or something. So
Yes,
glad
yeah,
you worked out the time zones.
This was better.
That's good. So I have a question for you, and it's more kind of zooming out a little bit, because it's so interesting, because behavior change is such a critical piece of implementation of any evidence-based, and it's something like bed nets. We know that they work, but why aren't they being taken up? Can you kind of describe how you got to the implementation science, like how you got the expertise and how you got the interest to that? And then if you could say a little bit about how you kind of navigate living in Uganda to do research as well as having a faculty position. I think that would be really interesting.
Yeah. Okay. Yeah. Two good questions. Yeah. Kind of career type questions. So I will say, I've been interested in malaria since I was a Peace Corps volunteer. So that was in 2003 to 2005. And I showed you some of those studies that I was involved with early on. And I've just always been fascinated. I have a very diverse background. I have a anthropology background and a computer science background. So I've found ways to bring together my interest in technology and my interest in culture, and obviously in health as well. So in terms of implementation science, I think that is one area where as I grow in my career, I still call myself, I'm in the 5th year of my K award right now, early career scientist. I think moving into more interacting more with some policymakers and hoping to take some of these lessons that I'm now getting from these tools, like I mentioned a few of them about the sleeping times and some other lessons that we're learning, and actually trying to translate them more into interventions that we can evaluate. And then obviously the next step is then interventions you can scale, and then looking at how to scale them. Malaria control is a whole. You can do an ethnography on that. It's it's a whole thing. It's very culturally dependent. I mean, you imagine I'm lumping together sub-Saharan Africa, but you can imagine every country and many regions within countries require very locally specified approaches. So I think there's ways that I'm hoping to grow and advance into that, and try to turn some of these lessons into policies and things we can actually roll out. And then your second question about kind of career-wise, I think the K has been very helpful. Obviously, that provides me 75% time to do my research. I spent last year here in Uganda and planning to spend this year as well. It does help that my wife also has a K award, so she has a lot of flexibility for travel. And so we have our family here. We live in Kampala. I think something that also helps me as well is I'm a general hospitalist. I'm not a subspecialist. So I'm also a nocturnist in particular. So my work is a lot of, and I purposely that was drawn to that is I don't have an outpatient panel that I need to be managing all year round, or sharing with someone, which is a real challenge sometimes, I think. So for me, I can do my night shifts, and then I can kind of hand off to my team. And so that's just in terms of personal choices, that's been really helpful. But I still do some pediatric work as well. I haven't done as much in the last year, but mostly in urgent care again, which is short-term care that you can do. But I would say if someone's interested in certainly my global health path has been research focused. There are other ways to get involved, teaching, quality improvements, more policy, more implementation science. Mine's been really around research, but certainly looking at some of those career mentored grants and the way to go. And UCSF is obviously a super platform to do that from. And if people are interested, I'm happy to talk to them individually as well.
Thank you. Other questions? Either come off mute or go ahead and put it in the chat. And I will also put a link to the survey in the chat if you all don't mind just taking a minute to complete it.
This is kind of an abstract question, but this is a super innovative technology and use of technology. And I'm wondering if, as someone who's plugged into that sphere, if there are other kind of things in the pipeline that you know of that are, this innovative.
Yeah, thank you. So, malaria in particular, over these last 5-10 years, where we see that malaria control is really just in coming up with newer tools and newer approaches and trying to use technology to do that. In terms of digital, find ways to leverage smartphones and leverage other technologies that are already out there. There's a lot of I don't know. Can you hear me? Can you guys still hear me?
Yeah, it is cutting a little bit
Okay.
in and out. Yeah.
Yes.
Now you're good.
Okay. So I was just saying that there are some really interesting things being done at Stanford in particular, where they're actually using smartphones to measure the sounds of mosquitoes, and they can use. I guess it's better than in the middle of my presentation, but
Welcome back.
I had such a thanks. Well, hopefully it won't cut off again. I had such a great answer for Christina. So I was saying that they're using there's some really cool technologies using digital tools to listen to the sounds of mosquitoes to figure out the species. There are there's a group at the BioHub that's looking at, using machine learning to look at, to do automated diagnoses of mosquitoes. There's a whole lot of technologies that goes across the wide range of both biotechnology to kind of looking at, human behavior monitoring, kind of more in the realm of what I'm doing. So there's a lot of really cool stuff. If you wanted to get in touch or if you have an interest, I'd be, I could point you to some people, especially UCSF in our collaboration, that are doing interesting work. And then in terms of just pure vector control, there's, as I mentioned, spatial repellents, toxic sugar baits, other ways that are taking a good understanding of the mosquito, a good understanding of human behaviors, and trying to fill those gaps. So there's a lot of cool ways, exciting ways to do that. We need more of them. So if there were any other questions, happy to answer them.
Any final questions? Many thank yous in the chat. That's what you missed out on.
It's all right.
Thanks so much, Paul, for being here. I'm Hannah. I'm one of the PEDS residents at UCSF. Hi. I know you had mentioned earlier that you used kind of surprise incentives to encourage use, and that seemed to work a bit. And I've noticed kind of in the health equity quality improvement space, at least in the US, that there are kind of increasing use of incentives and paying patients to do things. Have you heard of or see any work in the pipeline using more continued incentive for use of nets?
I haven't seen a lot of programs pick up on that in particular for bed nets. It's something that I'm still interested in. My wife is a health economist, and so that's kind of where that's how I got into it originally. And she's helped publish some of these papers with me. I'm still interested in using these incentives in kind of a pulsed fashion, in the sense that, like, you could use them, over, every month or so, every 2 months, and maybe you could help increase, the rates of Bednet use. Again, also focusing on high risk populations would be another idea too, like antenatal care. Often they'll give women Bednets when they come to their prenatal visits. And maybe another way to incentivize their, make sure they're being used would be to, like, give also some small incentives. I also thought about teaming up with this objective monitoring approach that I have with, like, even remotely, so that you could actually, objectively know whether the Bednet went up or down, and just give people incentives based off that. So there's different ways that you can do it, and it's something I'm still super interested in. I've written some grants that obviously haven't gotten funded, but in the past. But if it's something you're interested in, please get in touch, because maybe we can think of a project to work on together.
Thanks.
Yeah.
Udaya Shankar, sorry, we don't hear you. Can you check your audio? No, try again.
No.
Now we can hear you.
Okay.
And look out, Paul. This is going to be a good question.
So I was just wondering about, the economics and use related to Bednet use, right? So I've seen in very rural areas where, when it comes to choice of sleeping under a Bednet or having food to eat, people will use the nets for fishing. It's very common that bed nets are repurposed by the family to supplement economical needs. So I'm just wondering, like, how that plays in your research, and, whether you have any ideas what's being done about that, because that's definitely, I think, a fundamental step towards someone hanging it up. It's like the step before hanging up the bed net. Thank you.
Yes, yeah, that's a very good question. So this is not, it's definitely not a new problem. Repurposing of nets has been something that's been described a lot. I think that the main approaches that I've seen, it's not, these malaria prevention programs are not often tied to programs specifically related to poverty, or the income generation, or even small loan programs, which are they're growing and they've been around. There's not a great tie-in between those. Interestingly, there has been some research looking at, like, if people could prevent malaria, it actually would be a net benefit economically for the house, because it's days away from work for adults, and obviously children dying or being outside of school, like when they get sick with malaria. So if you can find a way, whether you're using incentives like Hannah was talking about, or with better education, to explain to people, to make it more clear what the economic benefits in the long run are, maybe that's another way to help with that. If you're talking about very extreme poverty, that's challenging. And maybe tying it together with conditional cash transfers and some other, more novel poverty focused programs would be, or even thinking of, like, suites of conditional cash transfers, in kind of adding in some additional health programs, whether it's immunizations or antenatal care, or bed nets, which are just like basic stuff that people need. Maybe bundling. I think I'm thinking of the word bundling these together might be another approach. But that's a very important point. It's well described that these free distribution programs, within a year or two, either through damage of the nets or through people that got them for free, can sell them for a small price. There's a very well described attrition of these bed nets. Poor households start with 5 bed nets, and then within a couple of years they have 2 left. So well described, and a really important point.
Thank you.
Thank you.
Any final questions? Well, thank you so much, Paul. Really appreciate it. Again, glad we got the time
Thanks.
zones right.
Yeah.
Good luck
Thanks
with your.
for, thanks for, thank you. Yeah, thanks so much. Yeah, it's due next month, so I'm
Yeah.
hammering on it.
Oh, October 5th.
Um,
Yep. Okay.
Yeah, that's right. You know.